And so, talking health, the Forum CEOs of state social health insurance agencies in Nigeria is pushing for a tax-for-service model to enhance effort towards achieving universal health coverage in the country. The call for tax-for-service model emphasizes the Forum's commitment to overcoming barriers and making healthcare accessible to all. Chairman of State Social Health Insurance Agencies, Dr. Simeon Onyenechi, during the Forum's 2024 first quarter review meeting in Abuja, stressed the importance of adopting informal tax as a means of development.
Rightly, taxes are things you pay, okay, as civic duties, but are not supposed to get a direct benefit for. But using tax for service model to encourage others to come aboard health insurance so that we can have a bigger risk pool. Anambra State has tried to do this. You get to Oyo State, for example, you see their drive with market leaders, traders, and what have you, to push the idea of informal sector insurance, getting artisans to form groups for them to register themselves in health insurance. That is moving them forward. You get to Delta, you see issues around equity, where the state government transited from having free maternal and child health care program to pushing these programs, funding them through the state's social.
In his address, Director General of Nigerian Health Insurance Scheme, Dr. Kelechi Ohiri, highlighted the role of government subsidies to support those unable to afford health services.
First, our primary objective is to improve access and coverage, and this will be arrived at by increasing enrollments across all the various schemes that we have to ensure that more Nigerians come under this umbrella of financial protection. The second thing is the equity agenda, which, building on what the government has done through schemes like the Vulnerable Group Fund and the Basic Healthcare Provision Fund, to operationalize and make sure that we can subsidize and provide care, that expansion of coverage is not just limited to the rich.
The Acting Executive Secretary of Rivers State Contributory Health Protection Program, Dr. Agatha Vetti, emphasized the need for extensive sensitization, particularly urging labor unions to integrate into the health insurance scheme.
And we're hitting the ground running. We are privileged to have the experiences of everyone here in this room. 36 states, 35 plus FCT. So all of the errors, all of the learning points, the mistakes, I'm hoping that we will not start from ground zero. We're going to be riding on the wings of some of the solutions that are homegrown and the innovations that have come up here for us to learn as peers. So I believe that we will do well, and we have targets for ourselves.
According to reports, since the introduction of state social health insurance schemes in 2016, over 5.5 million Nigerians have gained healthcare access through various programs. However, challenges persist as affordable healthcare remains elusive for many due to widespread poverty and reliance on out-of-pocket payment. Despite progress, health insurance coverage in Nigeria has made only modest inroads given the country's large population.